Hi, my name is Carlene Scipio, and welcome to our brand new TV series called From Our Perspective. From Our Perspective looks at the lives and behaviors of millennials, Generation Z, and the changes that are happening in our 21st century and the innovators that are making it happen. We will explore trends, technology, music, fashion, social media, business, science, the arts, faith, and lifestyle, and we will do so through the eyes of various generations. We would look at their interests, how are they changing our 21st century, what is innovation, and what role does innovation play in our lives today? Who are our innovators, and what is causing market disruptions, and what does that mean? What are the differences and similarities between Generation Z, millennials, and other generations? And can these generations successfully coexist? We will talk to visionaries, movers and shakers who are doing great things in our local community and around the world. From Our Perspective is not just another talk show. There will be roving reporters from the Caribbean, Europe, and North America. This will be a show of learning, exploring, questioning, listening, and creative ideas. So come join us on Comcast, Verizon, and online. Africa is the world's second largest and second most populous continent behind Asia, with a population of more than 1 billion people as of 2016 and about 30 million square kilometers. It covers 6% of the Earth's total surface and 20% of its land area. The continent accounts for about 16% of the world's human population. It contains 54 fully recognized sovereign countries, 9 territories, and 2 de facto independent states. Africa lies both in the northern and southern hemisphere, but majority of the countries are in the north. Africa's average population is the youngest among all the continents. The median age in 2012 was 19, when the worldwide median age was 30. The Kingdom of Lesotho in southern Africa is just over 11,000 square miles and a population of around 2 million. Its capital and largest city is Maseru. The economy of Lesotho is based on agriculture, livestock, manufacturing, and mining, with water and diamonds being the country's significant natural resources. Almost 50% of the population earns its income through informal crop cultivation or animal husbandry, with nearly 2/3 of the country's income coming from the agricultural sector. Lesotho, unfortunately, has one of the highest HIV/AIDS infection rates in the world. In 2016, life expectancy was estimated at 54 years of age. The country regards this issue as one of its most important developmental problems, and the government is addressing this pandemic through a national strategic plan. The Know Your Status campaign boosted the number of people being tested for HIV to 3 times the numbers tested in 2005. In this episode, we will meet Dr. Olabisi Emenanjo, founder of Community Health Advocate, a nonprofit organization dedicated to improving the quality of healthcare in young adults.
Hi, my name is Olabisi Emenanjo, and I'm an healthcare provider in the state of Maryland and also the founder of Community Health Advocate. And Community Health Advocate is an educational nonprofit organization that's dedicated to increasing our awareness on chronic disease in young adults and the community. And what we do really is we create awareness using our educational healthcare program through young adult and the community itself. And the ultimate goal for us is to increase awareness and also to decrease the prevalence of chronic diseases in our community, especially in the country like Lesotho, which is the second largest HIV prevalence in the world. You know, as an healthcare provider, it's very important to me to create this awareness. And to me, it's actually very personal as well, especially having a family member that passed on from complication of diabetes. And to me, I felt like, you know, it's something that everyone should be aware of. So that was one of the trigger at first for me. And also, my heart goes out to young adults because I remember as a young person kind of feeling hopeless and, you know, wanting open and wishing somebody was kind of there to talk to me. And I feel like I'm in that stage now to be able to give back to my community, give back to this young adult, and be able to be a source of hope to them. And that's how Community Health Advocate came about for me. What makes our program innovative? That's a great question. For us, I think is going back to the basic, which is prevention. When it comes to HIV, for example, especially in the country in Lesotho in Southern Africa, when there's so much talk about HIV medication, free testing, it's all over the place. But the basic is prevention. Nobody's really talking about the prevention part of it. And we truly believe that young adulthood is a critical stage when young adults start making critical decisions for themselves and start taking responsibility for their personal care. And if we can get them that young and be able to let them associate the difference, I mean, the relationship between lifestyle and chronic diseases, this we think that is the ultimate solution. So our motto is, you know, like awareness is the major key solution, but prevention is the ultimate solution. So what has surprised me most? I think for our organization is actually the amount of bureaucracy that goes on. For example, our mission is to go into school, into high school, and sometimes it's so cumbersome to get in. While I do understand that, you know, they should be careful and the government should be careful about people going in and talking to this young adult, I do also believe that when you have a credible organization that wants to do the better good for their community, there should be easier way to get in. And sometimes, especially for smaller nonprofit, it's so cumbersome that you can actually get discouraged and then you kind of give up. We definitely have done a lot of collaboration with smaller organizations in Lesotho, for example. And usually when we go to schools, for example, when we're talking about, let's say, HIV, STIs, we're always trying to collaborate with other people. One of the main people that we use is an organization that does alcohol and drug abuse. So we bring them on and we collaborate and we go into schools together. We also have this other organization, there's one called Basotho Men Living with HIV. We try to bring them on, and actually they mentor these young people during our workshops as well. So collaboration is very important to us. And yes, definitely, we're totally looking forward to collaborating with a big organization like UNICEF, UNAIDS, EGPAF, which those are the bigger organizations in Lesotho and actually in Africa in general. And we look forward to kind of collaborating and working with those organizations since they already have their roots in Africa. But what is most rewarding is actually, for me, is, you know, this young adult coming up to me asking questions. To me, that means that they actually understand what's going on and they want more clarifications. So it's rewarding to see some go into you know, a school and you see all these young adults sitting down and, you know, they're like non-interested, and then at the end of the program they're clapping, they're coming up to me asking questions, or even to the team, not just to me, to the team, asking questions and, you know, being appreciative about, you know, the education that they just got. What is my greatest success story? Really, I think it's mostly, again, impacting these young lives. I think that's the most success story anybody can tell. For a country like Lesotho, where, like I said, it's the second largest HIV prevalence in the world, and you actually have this young adult that actually, some of them, that's all they know. They don't know any better, and then coming to our workshops and being able to understand why they think the way they think, because we actually get into their mindsets and actually, let them understand why they think the way they think, especially in terms of rape culture. We explore stuff like that. And then at the end of the program, for them to understand why and for them to want to make a difference, for them to want to make a change, I think for us, that's just a success story all over. So for us, it's just getting the result, getting a message across, and saving one life, even if it's just one life, saving their life and preventing them from getting HIV in the future is ultimate for us. We decide to do the workshops. If we can get into school, we decide to bring them out. And that's what we did differently. We started doing the workshops. And it's so amazing because the workshops is actually more in depth and we have more time. We're able to explore more with these kids in the youth-friendly environment. They're more confident, they have more, they're more open, and I think the result is actually even better. Culture plays a very important role because everybody has their own culture, and for example, a place like Lesotho in Southern Africa, where is the second largest HIV prevalence in the world, you have to consider that. So for our program, actually, when we were in the process of building out the workshop, that was on top of our list, to be able to understand the culture and able to break the barriers, because if you don't do that, it's so hard to get in. A place like Lesotho, when there's high rates of the rape culture is there, we have to explore that, and that's what we do with the workshop. When we bring this young adult in, we actually explore their mind. Why do you think the way you think? Why do you think it's okay for this to happen? And even though culture is great and it's very important, it's not always the right thing.
The Republic of Liberia, on the West African coast, bordered by Sierra Leone to its west, Guinea to its north, and Ivory Coast to its east, a population of approximately 4 million, it covers 43,000 square miles, and its official language is English. The country's capital and largest city is Monrovia. Liberia has been faced with 14 years of civil war, which has caused major destruction to the country's infrastructure and economy, as well as significant loss of lives. The Liberian educational system has been impacted by civil unrest and the Ebola outbreak, which led to closure of schools in 2015. The country is now rebuilding and is showing signs of improvement and growth. Its government has focused on educating its youth through new school reforms. In this episode, we'll meet a woman who is forwarding the charge of educating Liberia's youth, Miss Julie Taitt, philanthropist and author of Living in the Real World.
I'd like to share with you the new book that I just published called Living in the Real World. Now, Living in the Real World is a success manual, and it creates an opportunity for everyone to find their individual destiny, to find out how to fulfill your purposes for being on the earth. It is an opportunity for everyone to get answers to life's questions globally. And I'm very happy to have the ability to share this book with people all over the world. And speaking of all over the world, I'm also happy to share with you some of the work I'm doing right now in Africa, and specifically the work that we're doing in Monrovia, Liberia. Now, the work that we're doing in Liberia involves a school, the name of which is the Julie E. Taitt Evangelical Lutheran School, which you'll hear me refer to as JET as we go through this conversation. JET is currently located in Yamatown, Findel, Liberia, which is about 7 or so miles northwest of the capital, Monrovia. Well, I think everyone around the world would agree that poverty is a significant limiter, and unfortunately, Liberia has a poverty issue there, and that poverty is really a barrier to people being able to be all that they can be. So one of the ways to escape or to overcome poverty is through education, to fulfill their God-given potential, to utilize the God-given gifts and talents that they have so that they can then turn around and sow those back into the development of their own country. There are so many young people who found a way to work around, who found a way to succeed and to excel despite the economic barriers that they're facing. So we have used technology in the school to create innovation. For example, we have created a computer lab. Now we're talking about a computer lab in a place where there's no city electricity, there's no running water, there are no toilets available, there are no paved roads. So therefore, we have found a way to get generated electricity through a generator, and we have six computers are there, and we've created a lab. Now, how is this so innovative? Well, not only is it going to benefit the students of the school that are there at the JET school, because of course, giving them access to the internet and to the computer will open up the entire world to them, which of course is invaluable. But we also realize there is a state-owned university about a 15-minute walk from our current campus. And that university, the University of Liberia, has roughly a 20,000 student population. And many of those college students also do not have access to the internet. So it is our intent to open up our computer lab as an opportunity to share those gifts with the university students to assist their learning. As well, it can become a source of revenue and income for the JET school as we charge minimal fees for those college students to come and use our computer lab. What surprised me the most is the absolute zeal that the young people and the adults have for education. Many of the parents make extreme sacrifices for their children to attend school because unfortunately many of the parents were not afforded an opportunity to attend school. And so even though the registration fee is $5 and it covers the cost of the uniform as well, there are many parents for whom that is still a financial barrier. But parents have worked 2, 3, multiple jobs, working late into the night because it is so important to them to have education for their children, because they too realize that that will provide an open door for their children to rise above and to continue to go forward in a global world and to be competitive in a global world. So I would like to partner with the Liberia public school system as well as other private school institutions. And of course, we won't forget the work that the U.S. government is doing there with regard to education, as well as other localities that are focusing on education, other countries, England and other countries that are focusing on education. And so I see great opportunities for partnerships. We're not there yet, but I'm hopeful, and we are endeavoring to create those kind of collaborations so that once again, the students at JET ELS can be advantaged in every way and can benefit from multiple sources of knowledge. One of the significant challenges with regard to the school in Liberia is actually America. Now, I know some people may wonder, how can that be so? Well, Liberia was actually developed by slaves who fled the American oppressive slavery system to seek freedom, and the freedom that they received was in the country of Liberia. So Liberia was started by Americans. There's also a great, I would say, reliance on America and a belief that America is going to come and rescue Liberia, that America is still very interested and focused on the success of Liberia. And so therefore, the people do not see the need for self-reliance or independence as much as maybe some other groups do, because again, of their connection to America. So I think that's a challenge in the mindset, getting the people to become more self-reliant, because there's an awesome pool of talent there. There are many, many gifted people, but they don't really see the value and the benefit of who they are and what they have to offer, because they're always looking somewhere else for support. What's been rewarding is seeing the fact that the school, the JET school, has doubled its enrollment every year it's been in place. Now, this coming fall of 2018 will be the 4th school year, and we've gone from 30 students in our first year to well over 150 students now. So we have seen the enrollment just mushroom. And in fact, the school was originally slated to be kindergarten through grade 6, but because of the increase in the enrollment, we now have so many 6th graders who have nowhere to go, and we don't want to leave them. So therefore, we've added grade 7 this year. So starting in the fall of 2018, we will go from K through 7. And so that is awesome to see the response from the community and the zeal that the young people have for learning. One of the things that I've learned is that people are more similar than they are different, no matter where you are in the world, and that people all want the same things. People all want health. People all want good family relationships. People all want their basic needs to be met, food, clothes, and shelter. So when I wrote the book, I was focusing on helping people to find their and fulfill their destiny. But what I realized is that everybody has a very similar destiny because we all want the same things, and that God's put gifts and talents in each of us. So success means different things for each of us, but we all want it. And we all have our own version of success, but we all want it. So what I think I've done differently is I've focused on the individual and helping them to utilize this book as a tool to find their own explanation of success. And I've helped people to find a guide and to use the study questions that I put at the end of each chapter to utilize those questions as a point of self-discovery and transparency. And it's very interesting because if you think about the millennial generation, for example, they are very big on transparency. They don't like the fakey, phony world of the baby boomers. They want transparency. They want to see what's real. But one of the things my book does is it helps you explore your own transparency. And in actuality, you can ask others to be transparent if you haven't taken that journey yourself to find out who you really are. So I think what I've done differently is help people realize that this book is not just a message to you, it's a message for you, a message about you. Well, culture, of course, is significant in every community all around the world. So everyone has their own culture, and culture creates your paradigm. And one of the things that I mentioned previously in my conversation was the role that poverty plays and the connection with the United States. Now, I believe that the people have suffered tremendously in Liberia. And by that I mean they had a very long civil war, which caused, of course, political unrest. It caused economic unrest. It caused health unrest. But that civil war period ended, and then they did have stable elections. And just recently, last year, they had a safe transition of power, or a peaceful transition of power. So I believe their culture is shifting out of that civil war period where there was tremendous strife and pain experienced by many people into a new paradigm where there is a peaceful land. And as a result of that, I think their culture is beginning to adjust to peace. But I also realize that poverty is still a very big issue in Liberia. And poverty, as I said before, can be very impacting. One of the statistics that I read that the United Nations had issued, I guess a year or so ago, was that 56% of the people in Liberia are public toileters, which means there's not sufficient toilet access in the home, in the community, in the neighborhoods, etc. And so that has a tremendous impact on being able to meet your daily needs, which you have to do first before you can move into education as a secondary need. So I think culture, beginning to see a peace culture there in Liberia, beginning to move past the poverty that has been so gripping and so crushing, will be a significant cultural change for them, and help project them into a global community, help them see themselves as part of the global community, and even more important than that, as a significant and important contributor to their own culture, as well as having a global impact. Well, with regard to the work at JET ELS School in Monrovia, we just actually purchased land to build a high school and continue the educational opportunities for the children there. The new land is about maybe 5 miles or less from the current location. So I see the school expanding, and we also intend to build an entire complex on that land, which will include not just a school from grades K through 12, but will also include a medical facility so that health services can be available to the citizens in that community. In addition to that, we're also building a community center so that we can offer vocational training to adults, as well as opportunities for adults to learn computer skills, catering skills, all kind of job opportunity training, so that adults in that community can be enhanced. And then we also want to rebuild the church, the Trinity Evangelical Lutheran Church, so that the community will have a bigger, broader place for worship and a hospitality house to house people, because we believe we're going to have visitors from all around the world coming to impart into us. So that's what I see happening in the next 1 year, 5 years, 10 years from now, that we will have an entire complex, and that complex will serve the many varied needs of the community. With regard to the book, I see the book Living in the Real World eventually becoming workshops and seminars that can be held in convention centers, churches. I also see it becoming a curriculum for various maybe study groups or Bible study groups or any other groups that meet to share and exchange and encourage each other. So I see the book becoming a curriculum, and I also see the book turning into workshops and seminars and retreats. BC, I'm so happy to have had an opportunity to meet you and to hear about the fantastic work you're doing in Lesotho. And even though I'm in Liberia, which is West Africa, and you're in Lesotho, which is Southern Africa, I still see some opportunities for us to collaborate and work together. What do you think?
I totally agree with you, and again, it's a pleasure meeting you as well too, and great job on what you're doing. It's amazing. But I think the base, if you could agree with me, education is the key. We both agree on that.
Yes.
And I think the way we can collaborate is actually bringing our expertise onto what you guys are doing. I know you guys are thinking about building a new facilities now, and you're thinking about actually having, providing service to the community. And I think that's where we probably come in, because we're big on that. And we do actually have healthcare providers actually volunteer their time to us as well too. So I think that would be a great way for us to collaborate. And thank God for technology, even if they can't be there physically, through technology or telemedicine, which now is being innovative, right?
Yes.
Now we can actually get things done. So I think that's a great way for us to collaborate, to educate your community through our expertise of professional healthcare providers.
Yes, and I am so happy to hear about the educational component that you have with healthcare, because we both agree that prevention is a significant facilitator to good health. And even just something as simple as hand washing, which was made a tremendous impact on the Ebola, is something that you all focus on, prevention activities. So I really think it would be great for us to collaborate.
I think so too. I think so. So I'm looking forward to that.
Yes, and so am I, BC.
All the best.
Thank you, and same to you.
Thank you.